Knowledge on the Go, the podcast brought to you by the PI Programs team at Vizient. I'm LaTammy Marks, Performance Improvement Program Director here at Vizient, and your host for today's episode. During the height of the pandemic, over 200 plus medical journals identified climate change as the greatest global threat. Today, we're going to take a close look at environmental sustainability in healthcare. In our recent collaborative, 30 organizations participated from across the country who focused on environmental sustainability by creating green teams, making product decisions from an environmental sustainability lens, and creating environmentally preferred policies and more. Today, we'll examine why sustainability continues to be top of mind for healthcare organizations and what they are doing to improve their sustainability. Joining me to discuss this are three people from UW-Medicine in Seattle, Washington. Louise Simpson, Associate Vice President of Clinical Integration. Tara Biss, Value Analysis Portfolio Manager of Strategic Sourcing. And Gabriella Henkels, Sustainability and Waste Manager for Essential Services. Welcome, everyone.
Hello, thank you for having us.
So let's get right into it. Louise, please tell us a little bit about your team and how you support environmental sustainability at UW-Medicine.
Be happy to. Tara's with Value Analysis and Supply Chain Strategic Sourcing, and Gabriella is at one of our hospitals, Harborview Medical Center, as the Sustainability and Waste Manager. And I work for our health system, the centralized office of the president, and I'm the exec sponsor for sustainability.
Why has environmental sustainability been top of mind for UW-Medicine?
UW-Medicine is an academic medical center, and our mission is to improve the health of the public. We really feel like you can't improve the health of the public without improving the health of the environment. So sustainability really aligns with our mission. And in recent years, UW-Medicine has experienced a number of climate events that have really made an impact, primarily on our emergency rooms, but also on our hospitals. We had a heat dome in 2021. And although 90 degrees might not seem that hot from the rest of the country's perspective, only about 50% of households in the Seattle area have air conditioning. And so our emergency rooms were just inundated with heat-related illness, and we saw a high number of deaths related to that climate event. We also had an ice storm with freezing temperatures, and we have a very hilly terrain, and so it became a fracture event where elective surgeries and other things had to be postponed to take care of all the patients that came into our emergency room. And then in 2023, we had wildfire smoke, so we saw a lot of patients with respiratory illness. So it's very real in terms of our healthcare operations. There are a number of external drivers as well. The state of Washington is very oriented toward climate change, and we have strict green building standards. There's a carbon tax that our hospitals have to pay. Our state Medicaid program had an incentive where they included sustainability, and if the Joint Commission has a new sustainability certification. There's just a number of factors that are making sustainability very important to our leaders. In addition, the staff and providers have been asking for change.
Gabriella, tell us about one of the first steps that you took in improving your environmental sustainability journey.
I joined Harborview Medical Center about 2 years ago, and Harborview has a long-standing sustainability program. When I first joined the team, I spent the first couple months interviewing our different department leaders, pulling data for our annual reporting, and then learning about all of the work that everyone at the hospital already does. We get a report card each year that compares us to other academic medical centers, and that was a really valuable tool for seeing where we had opportunities and where we had successful programs. For example, our OR uses a lot of reusable materials and a lot of reprocessable medical devices, but it has opportunities for energy efficiency. Our food and nutrition team has done a lot of work to reduce food waste, and they've also done a lot of work to reduce how much meat we're purchasing, and they do source some of our food locally, which is awesome. And then another opportunity that report card showed us was that we had a lot of opportunity in our supply chain. In that same time period, our Department of Anesthesia put a letter out to our leadership asking us to take a look at the central supply of nitrous oxide at our hospital. And some other hospitals in the Pacific Northwest had discovered that nitrous oxide central systems are very wasteful. They leak a lot of nitrous oxide, and not a lot of that nitrous oxide gets delivered to the patient. And nitrous oxide is a greenhouse gas. Any wasted nitrous oxide ultimately ends up contributing to climate change and is part of our Scope 1 emissions for the hospital. We have cryogenic tanks at Harborview, which are the worst offender for central systems. The tanks themselves are designed to vent nitrous oxide when pressure builds inside. So we are currently in the process of decommissioning our central system, which is going to reduce our greenhouse gas emissions from nitrous oxide by 90%, which is actually about 15% of our total campus's Scope 1 and 2 emissions. We're working with our burn center, our oral maxillofacial surgery clinic, and our anesthesia groups to get that system up and running.
What teams did you include in this journey and how you gained leadership buy-in?
When I started convening our health system green team, we included medical staff, anesthesiologists were very engaged in this work. Our emergency room physicians were very engaged in this work because of the impacts of those climate events. The School of Medicine, that specifically the teaching and research arms, were already working in this space. We included nursing staff, environmental services, supply chain, and the Office of Healthcare Equity, amongst other groups, including facilities planning and construction. We convened that group to form a health system coordinating committee, and together we defined sustainability, developed a committee charter, and set out to outline the work ahead. People who work in healthcare are primarily focused on patient care, so climate change seems a bit tangential at first. We wanted to make sure that people understood the connection between healthcare and climate. We did a lot of communication about sustainability work in our board reports, sharing presentations at leadership meetings to talk about what sustainability is, why it's relevant and important to healthcare, and acknowledging the good work that's been happening throughout the years, and also highlighting cost savings because as health systems continue to recover from the pandemic, financial benefits from sustainability are a big plus and can contribute to engagement and buy-in of leadership. The actions that we took that made the biggest impact in terms of leadership engagement include drafting an environmental commitment statement for the organization and circulating it and getting sign-off from our executive teams. We also established 3 clear goals that tied sustainability to our patient care mission and teaching and research missions. And our School of Medicine faculty organized a large symposium where they engaged leaders from state and local governmental agencies, clinicians, and others throughout health systems in the Seattle area. And we asked our CEO to give the opening remarks, and that was really successful in terms of engaging him and educating him about sustainability.
That's impressive work. With that, Tara, now that you are well on your way and have been in the continuous cycle of improvement for a while now, what is one success that you can tell us a little bit about?
I can't really pinpoint one, Tammy. We joined the Vizient Collaborative last year and realized that supply chain definitely had quite a lot of opportunity to improve. Although we were very successful in leading with our single-use device reprocessing program, which saves millions of dollars year over year, and we're keeping tons of waste out of the landfill. It's been a highly successful project that we're super proud of and have gotten cultural buy-in for that and clinical buy-in, which is probably the trickiest part. I give loads of credit to Louise and our executive leadership for helping build the culture around sustainability, and Vizient for helping pull it into supply chain more closely and bringing it more to the forefront. And looking at our dashboard, we saw that we were surprisingly low ranking in our environmentally preferred purchasing. And the first thing that we did was converted all of our facial protection category, not N95 masks, we excluded that, but all of the other masks and single-use eye protection, face shields, glasses, We standardized from 30 various products down to 13 and saved over $300,000 to the system. The bonus was that we converted to an environmentally preferred product. The cost savings wasn't even the driver, but having that environmentally preferred checkmark really made it easy to sell the project. I was pleasantly surprised that it wasn't difficult getting buy-in from the clinicians. They were happy to be able to participate in helping to alleviate some of that waste, either in the manufacturing process, which the vendor who we converted to has the highest ranking in the industry for their manufacturing processes of the facial protection. We're also in the process of implementing the exact same conversion project with our personal protection, head covers, shoe covers, isolation gowns. That'll save an additional over $100,000 for the system. This is the first time that we've had a system-wide policy for Utah Medicine around environmentally preferred purchasing, where we're vetting vendors and products for their EP attributes before we're awarding contracts. So it's included in our solicitation language. It'll be included in every time we're vetting a new product before we approve it to see how many attributes do they have and comparing vendors against each other. And it may not be the final decision maker, but it's making a difference. And I'm happy to say that our ranking went from 21 out of 30 to now we're 12 out of 30. We went from the red to the green on the Vizient dashboard in 1 year.
Tara, you made a great point where you talked about all those savings was not the driver. It was definitely more of a nice to have because the focus was environmental sustainability. The misconception may be that environmental sustainability focus does not drive savings. In UW Medicine's case, it actually did drive savings for them as well as improve their overall environmental sustainability ranking. That is awesome.
The conversation speaks to the need to create messages that speak to different stakeholders. The staff and frontline physicians want to see us addressing the amount of waste that results from healthcare operations. The faculty and others are very concerned about taking steps to reduce greenhouse gas emissions and reducing harmful chemicals in our environment. And then our executive leadership, they want to see all that, but they also like to see if there's cost savings in addition to the environmental benefits. By having multiple messages addressing the needs of different stakeholder groups, that helps build momentum and success.
I definitely agree, Louise.
I've been in healthcare operations for 25 years, and I have been part of many Vizient collaboratives, and I find that I always learn a lot from the other collaborative participants. In this case was also very true. It was really helpful to hear from the other collaborative participants to learn about their steps and where they focus their efforts and how they achieve quick wins.
Awesome. And I wish you well on your continued success. Tara, what were your lessons learned?
Step one was have that leadership buy-in and make sure you're proactive and keep the communication very positive. People like their pink and white striped masks, and we ask them to convert and standardize to blue and orange masks for our EPP attributes across the whole system. And dealing with that pushback was challenging, but the key lesson learned there was be very proactive with the communication and explain to everybody why it's important.
To add to what Tara mentioned, another lesson learned that I've come across in my time at Harborview has been to really leverage relationships with internal experts and clinicians. When we were working on the nitrous oxide project early on, our burn center was concerned about changing their workflow and not using the central system anymore. They use nitrous oxide in wound care on a daily basis, and they thought that we might be fully removing nitrous oxide from the workflow. So our anesthesiologist gave a presentation and socialized the idea of switching to a portable nitrous oxide system with that team. And having the anesthesiologists, who are the subject matter experts in this process, be there to answer questions and get feedback from that team was critical in getting the burn center's buy-in. Ultimately, the project's going to be a big benefit for the patients in that unit. They'll be able to use the portable carts at the patient bed rather than needing to transport those patients to the treatment room, which can risk wounds opening up during transport. This is going to be a great benefit to our patients too, which we're excited about.
Tying sustainability to patient care is an effective lever and really important. It all comes down to having healthcare facilities that are resilient in the face of climate events. It's taking care of patients who have been impacted by climate, and then it's making sure that we minimize the environmental impact from our healthcare operations so as not to negatively impact patients in our communities.
Well said, Louise. Your wealth of information is invaluable, and thank you for sharing these great gems. My important question to you as our audience is, have you started your environmental sustainability journey yet? If not, what are you waiting for? The time is now. Thanks to Louise Simpson, Tara Biss, and Gabriella Henkels for joining us today and sharing your insights, and thanks to our listeners for taking time to join us as well. Please join us for more Knowledge on the Go podcast. You can subscribe today, like us, and send us your comments at picollaboratives@vizientinc.com. We encourage you to keep the conversation going. Remember to put your knowledge into action. Until next time, I'm LaTammy Marks.